working and health conditions of the healthcare professionals in Brazil, promoted with the participation of the technical unit of health systems and services and human capabilities for health of the Pan-American Organization of Health. It was promoted by the University of São Paulo at Ribeirão Preto College of Nursing, collaborating Center of the Pan-American Health Organization and World Health Organization for the Development of Nursing Research, Secretariat of Labor Management and Health Education of the Ministry of Health and National Council of Health, National Council of Health Secretary. This event is broadcast by the channel of the School of Nursing of Ribeirão Preto on YouTube in Portuguese and English, and in the Portal of Innovation channel in Spanish. For the opening of this event, we invite Dr. Mônica Padilha, coordinator of the Technical Unit for Health Systems and Services and Human Capabilities for Health of the Pan-American Health Organization, Brazil. Professor Dr. Maria Helena Palucci Marziali, Director of the University of the College of Nursing of the University of São Paulo, Ribeirão Preto. Dr. Malicho, Regional Advisor of the Health Resources Unities of the Pan-American Organization, Washington. Dr. Marcelo Marques de Lima, International Technical Advisor at the Department of Health Work Management of the Ministry of Health, Brazil. Dr. Halison Dias Rodrigues, Chief of the Ministry of the Issues, Health Center Issues. Dr. Marcelo Ponte, Director of the Health Department. Dr. Sonia, President of the National Nursing Department, and Dr. Professor Carla Marina Ventura, Director of the Collaborative Center of the Pan-American Health Center, WHO, for the development of research in nursing. I'll give the floor to the Professor Dr. Carla Helena Ventura. Thank you very much. Good morning, everyone. On behalf of the professor, Dr. Maria Helena Palucci Marziali, I would like to greet all of the authorities that are here present today. And I would like to say hello to the participants who are taking part of the event in social networks. I'm very happy for taking part of this event and this event for the development of research in nursing from the College of Nursing of Ribeirão Preto University of São Paulo. I would like to thank and congratulate the group for the excellent work they've been performing on the topic, and especially Professor Maria Helena for her leadership and for sharing with us all of her knowledge and experience in the area of labor health. And now we are focusing on the impact of COVID-19 in healthcare professionals in Brazil. The topic of this event couldn't be more updated and necessary than it is. It shows effectively the contribution of research and the impact of life conditions and in healthcare professional characteristics, revealing the possibility of creating new policies. In this sense, this webinar integrates one of the strategies of this broader projects to broadcast and share the findings and to deep dive in the discussions of the topics. I would also like to thank all of you for your cooperation in help, especially for the PAHO, especially in especially Maria Helena Padilha. And I would also like to thank the collaborating center that has been working for 32 years, developing many activities along with the PAHO, along with Washington. So this collaboration with the PAHO is central, and it has been fundamental for us to achieve more and more relevant results for society. So thank you all, especially for those who are part of the PAHO, and also thank you for those from the Ministry of Health. And I would like all of you to have an excellent event. Thank you very much. Now I'm going to pass the floor to Dr. Eduardo Fernando de Souza. Good morning, everyone. On behalf of our president, Dr. Betânia Pereira Santos, I would like to say hello to all of our colleagues and all of the institutions that are taking part of this international webinar. And this topic, impact of COVID in healthcare professional health, is so important. The committee, the nursing committee, has been working in the crisis management in the department for 572 days in order to try and to offer quality in terms of safety of our professionals and our patients, as well as ensuring adequate assistance to all. So on behalf of Professor Dr. Maria Betânia, I would like to thank all of you for the invitation, and we are at your disposal here in Brasilia from the Crisis Management Department. I think that in the past almost 2 years of pandemics, nursing has had to reinvent itself and show how valuable it is. Recently, we've taken part on an event in Santa Catarina, and we held the first scientific event with more than 900 people present, and nursing has learned a lot. Unfortunately, we lost 869 professionals, but I think that today all the regional committees, the systems COFEN and COREN, we can offer assistance for all of the regional nursing committees. And we would like to highlight the creation of the Crisis Management Committee. It's the only one that is still active in the world. It's focused on nursing healthcare professionals, and it has a team that offers fast response to any institution, be it public, civilian, private, or military. Congratulations, Professor Maria Helena, from our dear nursing school of Ribeirão Preto, University of São Paulo, and a good event to all of you. Now, I would like to announce the presence of Dr. Rassum Diallo. And now I'm going to pass the floor to Dr. Marcelo Marques de Lima. Good morning, everyone. I would like to thank all of you for the opportunity of taking part in such an important event. Dr. Vinicius would really want to be part of this webinar, but he had to attend a different meeting, and he unfortunately is not able to be here with us. This event debates the importance of integrated actions in how to manage difficult healthcare situations. Professor Maria Helena made great efforts to put this seminar together, and I hope we have a good event, and good morning, everyone. Now I would like to pass the floor to Dr. Raulison Dias Rodrigues. Good morning, everyone. This is Raulison Rodrigues of the International Advising Committee. I would like to thank the Nursing College of Ribeirão Preto, University of São Paulo. I would like to thank Dr. Maria Helena, Rassum Diallo, Dr. Vinicius, represented by Marcelo, Dr. Ana Cláudia Souza Bastos, Dr. Mari Cho, Dr. Gladbach, I'm sorry if I'm not saying it right, Dr. Monica Padilha, who has been our partner in many other initiatives of the Ministry of Health. I would like to thank the invitation, and I would like to remind you that we are facing a pandemic, and we saw how the health departments all over the world and in Brazil made so many efforts. And the nursing and healthcare professionals, they are very important because they are in the front line. I would like to remind you that the representation of the WHO ratified an international campaign, which is to protect and invest together. And they declared 2021 as the International Year of Healthcare Professionals. This was a celebration of the efforts of nursing and healthcare professionals all over the world and in Brazil. We mobilized resources and expanded initiatives to cope with the needs of healthcare professionals in the future years. The Ministry of Health also agrees that it's necessary to revise plans and national and international initiatives. We are strategically organized to address the impact of COVID and other diseases. The ministry recognizes the efforts of the WHO and other institutions, and we would like to thank all the healthcare professionals who have been working really, really hard since the beginning of the pandemics, because they are essential for the maintenance of healthcare services. Finally, I would like to highlight the campaign launched by WHO in social media to raise the awareness of the continuous burden that the pandemic represents for healthcare professionals who are working in the front line. And it's a global campaign to mobilize help for such an important topic. In this context, our advisory department from the Ministry of Health of Brazil is supporting all of the initiatives, and we would like the results of the researches conducted by the University of São Paulo. We would like to share it with everyone. And we are at your disposal, and we are willing to get to know all of the other initiatives that you're going to share with us today. Now, I would like to pass the word to Dr. Mari Cho.
Muy buenos días a todos y a todas. Antes que nada, pues muchísimas gracias por la invitación a participar en este evento. Al equipo de la Escuela de Enfermería de Ribeirão Preto de São Paulo, en nombre de la doctora María Elena, muchísimas gracias. A mi colega Mónica Padilla y a todas las colegas y a los colegas de la OPAS de Brasil. Igualmente, muchísimas gracias por tener en consideración la posibilidad de representar a la OPAS de nivel regional. Estamos realmente considerando que este evento es muy importante, dado que la COVID-19, que consideramos en un primer momento que podría ser un evento de corta duración, se está prolongando en el tiempo y afecta muy principalmente a todos los trabajadores de la salud. Consideramos que esta reunión en donde se trate sobre la salud y la seguridad de los trabajadores de la salud y las
and all of the healthcare workers and the policies that should be taken with respect to in how to advance in a future, in an agenda of the country that is pending and we have to develop to strengthen human resources is extremely important. So once again, thank you very much for the invitation to participate, and we will put all of our efforts in all of the policies so that not only in Brazil, but in the entire region of the Americas, they can be shared, all of the lessons learned, the good examples can be shared so that, in fact, we can progress towards universal health. Thank you very much.
I would like to pass the floor to Dr. Hassoun Diallo.
Hello, good afternoon, good morning, everyone, and very, very happy to be here. So I just wanted to take the opportunity to thank all of you for the opportunity to participate in this important event, and also to express the gratitude of my director, the director of the Health Workforce Department in WHO headquarters, Dr. Jim Campbell, who is really interested in the work that you are doing, and in particular, how you are shaping the agenda around health workforce. And I was also very happy to hear from the Ministry of Health of Brazil, who mentioned the International Year of Health and Care Workers. And this International Year of Health and Care Workers focus on two main topics, the investment and the protection. And I think these different elements would fall under the remit of this event. And I am happy to collaborate with you and to share some of our lessons that we learned in this context of COVID. So I will stop here as an introduction, but I will be happy to also present a short slide deck on the work that we are doing and the overall situation in the world. Thank you very much.
Registramos a presença entre nós do Dr. Haroldo Pontes.
We would like to register the presence of Dr. Haroldo Pontes, and we would like him to invite him to the floor to say hello to those who are present. Good morning, everyone. And on behalf of CONAS, the National Committee of Healthcare Secretaries of Brazil, it's an honor to be here. We are being summoned to face complex situations. Here in Brazil, we have a public healthcare system that has been managing to respond to this situation. I would like to affirm that without SUS, the difficulties we are facing today would be much worse. It is a solidarity policy. So we are here and we have been working on to find answers to the problems faced by the population. In the second table that we're going to host today, I will be pleased to share a presentation about the topic, and I'm pleased to be part of such an important event. Thank you very much. Now I would like to invite Dr. Sonia Asioli to say a few words. Good morning, everyone. I would like to thank the invitation on behalf of the National Nursing Department, and I would like to say hello to all of the Brazilian authorities and Dr. Maria Padilha. And it's a huge pleasure being here with you and being part of such an initiative that is joining so many entities and people and brains in order to think about the impacts of COVID in healthcare professional work conditions. I understand that together we are gonna be able to take steps ahead in this topic, and in a moment of such difficulty and so many crises, sanitary crisis, political crisis, it is central to reaffirm the defense of some principle, the defense of the health, so that we can think about strengthening the work conditions. So I would like all of you to have an excellent meeting, and I would like to say that I am at the disposal of all of you to develop combined solutions. Thank you very much.
Ouviremos a professora
Now, we will listen to Professor Maria Lúcia Padiali. Welcome, everyone. It's an enormous joy to be here. I'd like to say and thank Monica Padilha, who is the mentor for this project and the impact of COVID-19 and labor front and health conditions here in Brazil. This was a challenge that Dr. Monica called us to with the team from PAHO and the nursing school, together with Ana Paula Cavalcanti, the professor, who's been working with us closely to get this project up and running. This project and the seminar is one of the products that came off of this project, which is a research and has two parts, which we will present some preliminary results to you. But its main objective is to really broaden the discussion about what's going on in the country to beyond of what we can do together as well for the country and for the workers of this country. So I'd like to thank the participation of all the international guests that we have here with us, and in the name of Dr. Passun, I'd congratulate all of you and thank you deeply. Also thanking our partners here within the territory. And I'm going to highlight Marcelo Marquez's name for the collaboration from the Ministry of Health. And these were people that are working with us for almost a year in this project so that this could happen here today. We also have the participation of a very important team, which is our technician team, also from PHO, as well as the School of Nursing from Ribeirão Preto, who have helped us with technical issues. They also learned, and we are here today all together, being able to talk. And so for those of you who are listening to us, watching us through the different channels, the Innovation Portal and the Nursing School, welcome. And to our guests who are following us from Zoom, I hope that we can broaden the discussion and that each different section here will have the possibility for questions, Q&A, and we hope that this is just the beginning of a much broader discussion that may continue. So Dr. Monica Padilla, thank you so much. Dr. Monica Padilla has always been pushing forward the discussions and strategies to face COVID-19 in our country throughout the health sector. So in our name, thank you so much. To begin the session, we are going to listen now to Dr. Monica Padilla. Thank you, everyone. Good morning, everyone. I'm very happy to be here in a meeting of colleagues and different strategic authorities, starting with the Ministry of Health, the National Council for Health, the security sector, and friends who are here in IC, including the Secretary of Health. I'd like to comment and thank all of you for being here present with us and to launch, let's say, a couple years ago, this work that is intersectoral and strengthens all the actions that we work on. I'd really like to thank the words about the international presence that Brazil has had within this field, as well as the presence from the WHO that represents to us the working structure that we've been trying to work on with this topic. I'd like to say that the topic that we are facing right now within this pandemic allowed us to identify the importance of staying together when we have such an enormous challenge before us. And the councils of human resources and health and the health centers have an intersectoral characteristic that involves work, education, finances, and the health services. In this sense, the policies can only be created when we move forward. And that's why we have called the WHO to celebrate and to recognize, but also to research the consequences that could come out of this period with the workforce. I'd also like to thank the financial support that we received from WHO that allowed us to move forward with this process and this work, both technically and financially, has been present with us. And the challenge to find the proper information, this has been one of the most difficult aspects of this whole process, because the search for information has become and proven itself to be a very important task. And we've been working with partnerships with each one of our colleagues moving forward in this sense. All of these elements together also form a commitment of the country to work on the techniques that WHO and PAHO have according to the national finances, according to what WHO provides and suggests. And all of us here have been able to participate with the global scope of the pandemic And now this is a third operation that was enormous. At this moment, all the participants are represented here in the process, and we're going to share one of the efforts that we had and share also the other levels and the other levels of discussion that we had, so that we can guarantee that this moment here is a space and that we can support each other, knowing that we're moving forward and working together. I'd really like to thank deeply the possibility of being here and to the Center of Collaboration that has been so important, and the work from the Ministry of Health and all the different participants in this process. I'd like to thank the presence of everyone here and wish that this meeting is very productive, and everything that we take from here that we can use and work. And we know that it's a very important challenge that was put forward right in front of us and impacts the health system. So our work is to be able to work together and invest, and this is a daily task challenge. And as Haroldo mentioned, we have to continue with these agents, strengthening them. So I thank deeply the possibility of speaking to you, and I'm ready to start with our roundtable and with everyone. Thank you so much. So at this moment, we invite Karen Labach to be the head of the mediator of the table about public policies that guide in the sense of mitigating the impacts of COVID-19 in labor conditions and health conditions of health workers. We inform that the participants may be able to send their questions to the spokespeople during their talks through the link that's available in the chat box. Dr. Karen, the floor is yours. She is mute.
Thank you very much. Thank you to everyone, and thank you for this impressive group of people that are together today for this very important topic. I'm Karen Gladbach from the PAHO Regional Office of the Americas in the Human Resources for Health team. And this morning, the first thing we're going to be hearing from two speakers who are going to be presenting on this topic. We know that healthcare workforce shortage was an issue prior to the pandemic, and it's just been exacerbated by the pandemic, and especially the many occupational challenges that have come with that. And so this morning, we're going to be hearing about the data behind that, and also what the countries have done to mitigate the impact of COVID-19 on the working conditions and the health of the healthcare workers. So for our two speakers, who you've already heard from briefly, we'll be presenting that at the global level and also at the country level in Brazil. Following their speeches, we're going to be hearing remarks from Dr. Cho. Just as a reminder to those who have joined us late, the interpretation is below, so you have the opportunity of listening to English, Portuguese, or Spanish. And for our speakers, the presentations will be 20 minutes long, and I've been asked to keep you on target. So what I'm going to do is actually put up at 15 minutes a yellow card so that you have an idea that 5 more minutes to wrap up. And then I'm going to put up the red card to let you know that your time is up. And then following that, Dr. Cho will have 10 minutes for remarks, and I will do the same and give her at 8 minutes the yellow mark and at 10 the red. Then hopefully we'll have an opportunity for a few questions afterwards. So to start, we're going to have Dr. Kassoum Diallo joining us again from WHO Geneva. And many of you may know Kassoum. He is a statistician and demographer who has extensive experience in statistics, monitoring and evaluation, research and knowledge management. For the past 25 years, he's provided technical support and capacity building to governmental, NGO, and UN experts around the world. He's worked in various UN agencies, including UNICEF, UNHCR, UNFPA and WHO, also in academia in Africa, North America, and Europe. And most importantly, and as he's joining us today, is in his role as the unit head of the Data, Evidence, and Knowledge Management Unit in the Health Workforce Department at WH headquarters. And he is in charge of the implementation of the National Health Workforce Accounts, the NHWA, that some of you may be familiar with, which is helping us to gather this data globally. So with that, Kasum, Dr. Diallo.
Thank you very much, Karen. And it's a great pleasure, as I said just a few minutes ago, to be here and then to share this work and then the experience with our colleagues from PAHO, and have had a long work experience with PAHO for many years now. And I really enjoy the professionalism and then the work that they have been doing. And I would like to take this opportunity to thank you all for the invitation, in particular Monica Padilla, Karen, Ana Paula, and everyone. So it's really great to be here, and then this event is very important. And as I mentioned also earlier this morning, we had the representatives of Minister of Health of Brazil who mentioned the International Year of Health and Care Workers. I think this is the umbrella under which we coordinate all the work, and in particular linking the work on the health workforce to the COVID-related work. And it's my pleasure here really today to share some of the slides that summarize some of the work that we have been doing. Let me just maybe for the sake of time, just start projecting. I'm not sure if you can see my slides.
Not yet.
Can you see them?
No, but it says you have started screen sharing. We don't yet see the slides. There. All right, now they're just in slide mode.
It's coming?
It's not on slide mode yet. I can see them, but they just need to be into slide mode.
Okay. Yeah, this time I can project now.
Yes. Okay.
Okay. I have been asked to
Kasum, it's still in, we still see all of the slides. It's in presentation mode.
I am in presentation mode now, but
all right.
Shall I stop and share? Sorry?
I think if you do double click on the presentation, may open it.
Let me see. Okay, let me stop sharing and share again. Sorry.
Okay.
Apologies for that. Can you see?
You can see it. If you can try again now, just for the slide, the presentation mode. Try one more time. If not, we'll just. And you're double clicking?
No.
All right. Well, I think you can move. It's still showing the other slides, but we can see the main slide. So you can go ahead. Somebody.
Okay. So which slide are you seeing now? The first one?
The very first one. We are seeing the title slide, public policies.
Okay, perfect. I've been asked to present on the public policies to measure the impact of COVID on the working condition and healthcare workers. I think this topic is extremely important. And that's why also we have been having a series of the impact and see how we are going to address this. So in this presentation, which slide are you seeing now? The number 2 or?
Yes, understanding the outline of the presentation.
Okay, perfect. So in this one now, I'll be talking about the impact of COVID on health and care workers. clarifying what we mean by impact, and then also the country experiences in managing the health workforce in this context of COVID, some of the public policies and mitigation measures that have been taken. And of course, I will share with you some guidance that we have developed in the context of this work. So, first of all, it's important to understand that in reality, when you look at the impact of COVID on health in general, and this has been studied by WHO in 135 countries, we are seeing that the human resource for health issues are the most important bottlenecks that countries are facing. Because if you see this, the pulse surveys that have been conducted, you see that 2/3 of the countries are reporting challenges that led to disruption of health service, essential health services due to human resource for health challenges. So that's important. It's showing really the importance of human resources for health. And if we don't address these issues, that will create some other challenges, because the impact will be also jeopardizing the availability and ability to address the other health services and then the other disruptions. So in this context, we have to clarify what we mean by impact. Unfortunately, when we are studying impact, most of the people are thinking in terms of really impact on health and care workers in terms of infection and death, and probably some of the mental health things. But we want to offer a comprehensive understanding of the impact of COVID on health and care workers. This comprehensive understanding is showing that in reality, there is a multidimensional impact of COVID. There is a health-related impact, of course, but there are also impact related to availability and distribution, the working condition, and the social and well-being. And in each of these dimensions, there are some different components that you can look at. In particular, when you look at the health, infection and death is something that we have been studying most. But stress, burnout, and other mental health disorders are there. And these are some of the things that impact the availability of the health workers to deliver essential services and to face the COVID challenge. On the working conditions, we have witnessed in many countries that there have been some labor strikes or some different types of contracts that had an impact on the decent work of those health workers. And of course, we are not starting as in most of the middle and low income countries. Countries are starting with already having a shortage of health workers. So with the repurposing to COVID, most of the people, health workers mobilized to address COVID, the availability for health workers to deliver other services is quite limited. And these are some of the things that we have to take into account. And of course, there is a social and well-being. Stigmatization is there, discrimination is there, because we've seen even in Europe where some health workers were facing community stigmatization because people at the beginning of the COVID were saying, I should not take the bus with this person, or I should not live in the same household or the same building with this person because he's working on COVID. And so those are some of the things that we have seen. So understanding the impact of COVID require a more comprehensive assessment, and that's what we are doing. And when you look at this, and in particular, we have had some numbers on all these dimensions. And we've seen, for instance, that 2/3 of the service disruptions in different facilities in all countries, including in high-income countries. We have reported 84 recorded labor strikes, of which 38% are due to lack of decent work, and then can be also indirectly linked to the COVID. Health and care workers, infection and death. We have seen also, a lot of mental health related issues, depression, anxiety, prevalence of insomnia, and etc. And we have seen also that 24% of the health workers declare in many countries that they had to return to work while still having COVID because of limited availability of health and care workers. Those are some important things that we have to keep in mind. Let's not think impact only in terms of infection and death. The impact is much more than that, because these other dimensions, they have also an impact on the availability of the health workers to deliver the services. And these are some of the indicators that we have done. We have done a number of country studies, and then you can see here that both infection and death, but also the others, have an important impact on health and care workers. Last week, Dr. Tedros launched a study on the mortality of health and care workers due to COVID. And he stated that between 80% and 160% of the health workers have died. And these are coming from different estimations that were prepared, not only by WHO, but by some other like IHME and some other institutions. And we are seeing also that there is no equity in terms of the vaccine availability. The data reported, I'm talking about reported data, not available data. The data reported mean that the data that we have here in WHO, we know many countries have vaccinated health workers and we don't have the data, is showing some significant challenges that health workers are still facing. Not all health workers have been vaccinated in most of the countries. Still, in relation to measure the impact, we have done a number of country case studies covering 27 countries in PAHO and in AFRO, just trying to see what was the most important challenge that health workers are facing in this. And you will see that not only in terms of infection and death, but we are seeing also episodes of stress, of burnout, absenteeism, and then poor availability of IPC, like the mask and the gloves and etc. Those are some of the really impacts that we have seen globally, and there have been additional studies conducted in all other regions, like in Southeast Asian region, in Western Pacific region, that are showing similar trends in terms of the availability of protection measure for health and care workers. At the beginning, the situation is improving, we must say, but at the beginning, those were some of the challenges that we will see. Now you will ask me, what have been the mitigation measure? What policy responses have been assessed? I mentioned the case studies that have been conducted in some of the PAHO countries, and you will see that, for instance, in terms of the working conditions, there have been a lot of temporary recruitment and the use of volunteers. There have been also some incentives that have been put in place, not only to have more health workers, but to maintain health workers in providing the service. And you have also seen some staff and well-being related stigmatization and how the countries have addressed those issues. And many countries are using also what we call the Cuban brigades, having more Cuban workers coming to support this work. And this is really what you see here are some of the PAHO countries. But in other countries, the other policy options that you can see here, we have some countries that had the redeployment of health workers, recruitment of additional health workers, and faster recruitment using the international migration. All those are some of the mitigation measures that have been taken into account and have been used by many countries to address it. And in relation to that, WHO had developed what we call the health workforce policy and management in the context of COVID that include a number of policy options and intervention at different levels of the the health pyramid, including intervention to support individual level, capacity building, organizational, and also the system-wide, and then the environment. And in each of these interventions, you will see that there are some policy options that are available for countries to use. And this is a bank of options that many countries have been now testing. Depending on your country context, you can actualize those measures and see how best you can address these things. And of course, there have been a number of lessons learned. These lessons learned include first making sure that you address the impact in a more comprehensive, in a more holistic way, rather than focusing only on infection and death. The second is in relation to really making sure that you mobilize more health workers, additional health workers, to address the issue rather than jeopardizing the maintenance of essential health services, making sure that the health workers are equipped with additional skills and competencies. So investing in more health and care workers, protecting them more, and using some agile work things. All these mean that you have not only to invest in more health workers, but to improve the working condition and offer decent work to health workers in order to better address the COVID response, the COVID pandemic. And some of the key messages that I want just to share at the end of this thing. First, it's a serious multidimensional impact that COVID has on the health and well-being of health workers and health and care workers. Countries have different situations and they adopt different measures to address these things, but most of the countries have responded to the pandemic using the bank of options that have been offered in consultation with WHO and many other partners. And it's important to highlight that the pandemic has confirmed that it's absolutely critical to invest in health and care workers, and that's important to keep in mind. Investing and protecting are the topics of the International Year in Health and Care Workers, and this is something that we have to maintain, because once the pandemic is gone, we still need health workers to deliver all the essential health services. I thank you for your attention.
Thank you very much, Kasum. And I appreciate you staying on time. I didn't even have to put up the yellow notice there. So you were able to give us a global perspective on it. And now what we're going to do is move to the country level and talk about some of their data and how it's been dealt with in the level of Brazil as far as the different policies. So we'll have questions afterwards, Kasum. So now I'm going to invite Marcela Marquez de Lima, who you met previously, to speak with us. And Marcelo is the project management and development focal point in the Labor Management Department, Secretary of Work and Health Education Management in the Ministry of Health. Marcelo.
Well, good morning, Mrs. Karen. Good morning, Mr. Kasum. Thank you for presentation. I greet you in English, but I will make my presentation in Portuguese. Just só um segundo. Vou apresentar aqui as estratégias para enfrentamento da COVID-19 no Brasil.
I am going to share with you the impacts of COVID in Brazil. I divided the presentation into 3 strategic initiatives. The first one is Brazil Counts on Me. It was a strategy of fast response to face the pandemic. We also had initiatives in mental health, and the third initiative, which is the SOS initiative. It is Brazil's response to the pandemic and to emergency situations in public health. The strategic initiative was divided into 3 axes of initiative. The first one is focused on scholars, and the target were graduation students of med school, physiotherapy, pharmacy, and nursing. And the objectives were to include students in the last year of those courses. They could start working in the healthcare system to optimize the service rendered by the public system and strengthening our response. So Brazil had, the second axis of the initiative was focused on graduated med professional who were interns. It was established by Law 580, and the target were healthcare professionals who had already graduated and were interns in any specialty. So we gave these professionals bonuses so that they kept studying in their programs and also started working within our healthcare system. The bonus was 667 reais, and we had 55,000 interns taking part of the program. And then we have the third axis of the initiative, which is healthcare profession. This was focused on training healthcare professionals to face the pandemic. It was also established in the 31st of March 2020. The target were healthcare professionals who were actively working in their respective councils, regional councils. Here in Brazil, we have regional committees, and in order for a healthcare professional to work in the healthcare system, they have to be registered in those committees. And the objectives of the initiative was to train the professionals so that they could become better professionals. We have the largest number of healthcare professionals in the country. We have 1 million, about 1 million professionals. We had the registration of professionals divided into regions, and whenever a state would request more healthcare professionals, we would check in this bank and we would find professionals. And we had a few cities that hired this additional workforce to help their network. Here is an example of states and cities that benefited from Brasil Conta Comigo initiative. Now I'm going to talk about initiatives in mental care. They were initiatives that addressed problems related to COVID-19, but other problems as well. It was very evident that mental issues became emergent, and during the pandemic, the target was the population in general, but there were initiatives focused on healthcare professionals. And the objective was to reduce the stigma related to mental health. And we also wanted to promote mental health and prevent diseases. We addressed many different topics like depression, anxiety, growing old in a health way. Another initiative that is a more recent initiative is a training program that multiplies urgencies and emergencies in mental care. It is an initiative focused on healthcare professionals who work in urgency and emergency. So the target is those types of professionals, and the objective is to train professionals that work in this field to be ready to work. One thing that increased a lot during the pandemic was work holds related with people who were drunk and having panic crisis. So these professionals, they had to deal with it. This is why we've developed this program in order to train them to better handle those situations. The training isn't remote, and the objective is to let these professionals understand the problems and decide which is the best approach to deal with those types of patients. We in the Ministry of Health are in the end of an important study that we performed, which is related to the impact of COVID in healthcare professionals. It's a very significant research study. We will have results soon in order to make analysis and comparisons. And we will have data from the different moments of the pandemic up until today. Now I'm going to share with you another strategic initiative. It hasn't been formalized legally, and it still needs to be reassessed. But I'm going to introduce the strategy so that you understand why we created this strategy. The objective is to contribute to a strengthening of the public healthcare system to respond to situations of urgency and emergency. We divided the strategy in 5 axes, and this initiative was created by a need to be ready to deal with the COVID-19 pandemic and any other situation of public healthcare emergency. Because when we have a situation like this, the services of emergency and urgency are the ones that get more stressed. And it's important to qualify the professionals that are part of this network. So the idea of this project is to try and anticipate ourselves to qualify the professionals who work in emergency and urgency to deal with situations of public health emergency. So the initiative is divided into 5 axes, which the first one is training on how to deal with critical patients. The second one is managing critical emergency situations. The third one is to create training centers to support the professionals regionally. The fourth one is to establish the basic protocols that the Ministry of Health already has. And the third one is the creation of a platform that is broader, because we still are extremely focused on COVID-19, and we want to expand the platform so that healthcare professionals can work, can volunteer to work in any emergency situation, deciding where they want to operate. So training, focusing on critical patient approach. So we want to train healthcare professionals that are part of the network of urgency and emergency. Brazil is a very big country. We have a population concentration in the capitals of the states, but We have healthcare professionals spread throughout the entire territory, and we need every healthcare professional to be ready to deal with situations like this, critical situations. We are planning to train 10,000 healthcare professionals in Brazil. And we included some of the sustainable objectives, and the training is support in cardiovascular life support and trauma, and capacitation in mechanic ventilation for doctors and physiotherapists who work in intensive care unit. And I would like to highlight the support of AHU and the creation and performance of the project, especially in these axes.
The second axis would then be, of course, emergency situations that the pandemic for COVID-19 has highlighted, is that not only do we need professionals that are capable, but also having professionals that exert this leadership in emergency situation. That's an important one. So that's why we've identified this specialization in emergency situations. And it would be important to get education for these people in an emergency situation, managers, both from cities and states, as well as those from the specific health centers. We expect to strengthen our local capacity to be able to respond to this type of situation, and also that these managers can, in a better way, communicate among themselves and integrate to the health department and firefighters in this situation of a public emergency situation. And we thought of two specializations, one for management and the health management in emergencies, that consider how you communicate with the press, how you communicate with the family members of those who have lost a family member. And also talking about an intensive care unit that was put at stress during this pandemic, and to create this environment within the intensive care unit. And it was very important to have this, we noticed, during the pandemic. So the idea would be that we would create these education models. We would have a basic one that would be open to the general public for any healthcare worker. They would have access to this education intermediary level with a little bit more of focus, suggestion of key participations, and we would expand their participation in the future. And then at advanced level with the true key players, with managers for healthcare units and so on. And I could stop here. We would also have independent and complementary models, and then assess the conclusion of this education program when they receive the certificate. We'd have a third tier here, which would be the structure of these education centers. And the idea is that for us to be able to educate during the pandemic and to provide really capabilities, we would have to establish these places that were already established within the Brazilian territory, and who would be the professionals that would compose and educate, multiply this knowledge among the other healthcare workers. So the idea would be that we would have this situation put together in a real sense of the situation, so that we would be able to respond in a faster, quicker, more impactful way. When I talk about emergency and public health, I'm also talking about and the situation that we have here in Brazil, for example, with dengue or flood or a situation of a landslide or even a pandemic like this one, such as we had with the COVID-19. So we would have these capacity models with the mobile emergency units, which here we call SAMU, and so that the healthcare workers would not be dependent of others, just one on the other, but rather have a team that is permanently provided with capacities. So we would have protocols that are well defined. To certify these professionals, we would need to certify all the protocols that we already have within the Ministry of Health. They would need to be updated with a higher frequency, because the last update, if I'm not mistaken, is from 2015, for example. So we want to, apart from update the protocols, provide a certification of capability from the Ministry of Health, and that way we'd be able to know who and which are the professionals that are distributed among the national territory, mainly in situation that is more evident of an emergency. So apart from updating the protocols, we'd also have these centers of education and capacity providing among the territory with the label from the Ministry of Health. Together with this proposition, which is our starting point for us to suggest this project, which is that here in Brazil, we understand and we see solidarity in general, the healthcare worker is very solidary. They understand a specific area that needs them. So we had many of these workers available to work, and we want to broaden this action, which has already shown benefits during this phase of the pandemic that we just had. And then we would have a data bank of health workers that would be able to work not only in emergency, not only with the pandemic, but also the basic module be offered to any healthcare worker that would register themselves on this platform. So we'd have the professional workers, then the national workforce from SUS, which is the Brazilian National Health System, both on the support to this entire emergency situation. And these professionals work together with our secretariat. They did this throughout this pandemic that we had, as well as the Health Secretariat Bureau, which will work during the pandemic and after the pandemic, being able to make the best of this. And the expected result is that we'll have a register of these HCWs, and that we are able to prepare better the states and cities in work and put together a network in an emergency regarding public health. I think that is it. Thank you. And now I leave the floor open for questions.
Thank you that's the timer. Thank you very much, Marcelo, and for staying on time. Also, I just appreciate your overview of the situation in Brazil, one of the countries most impacted by COVID, and how it was dealt with. And most importantly, how you took us through where you're going in the future with the strategy and the 5 points. And with that, now we're going to have, we'll have questions and answers afterwards, but now we're going to ask Dr. Molly Cho to give her remarks, her comments on the 2 presentations. Dr. Cho is a medical doctor with master's degrees in 4 different areas: blood services management, business administration, public health, and health economics. So you can see why we've asked her to give her perspective coming from with all of that expertise in those different areas. She's going to give a regional perspective. She's been with PAHO since 2005 and worked in several of the countries and also at the regional level in Washington, DC. And since 2019, in her role as the regional advisor in human resources for health. And so she's going to be sharing with us today that perspective. Molly?
Muchas gracias, Karen, y muchísimas gracias.
Thank you very much, Karen, and thank you to both speakers that spoke before me. What they shared with us clearly shows us that this is a very important theme. Political decisions and fundamentally public policy are necessary for modifying the status quo of the situation in most countries. As was mentioned by both speakers, COVID-19 alerted the healthcare systems around the world, globally really, and also highlighted the importance of healthcare workers around the world. Today, we are still limited in the way we provide basic healthcare around the world. And these basic healthcare services were highly impacted ever since the beginning. As Professor Diallo mentioned, Dr. Diallo mentioned, more than 100% of healthcare services have a lack of healthcare professionals, be it because they have fallen ill or even died, or because they were removed from a basic healthcare service because of risk conditions, for a lack of EPIs, personal protective equipment, or because they were relocated to services of higher demands, or where they were made to exercise other functions due to the sanitary restrictions of COVID-19. For example, family health that has fallen along the way, or maybe because the job and employment conditions did not validate the risk of continuing to work. We have to consider a very important component in all of this, which is that more than 70% of all healthcare workers are women, and these women during the pandemic and also in common life, besides working professionally, they also have important roles within the households and taking care of their families. So the double journey, and they during the pandemic had to take care of their children, had to take care of the elderly and those who depended upon them. We know that even though healthcare workers were enlightened as heroes during the pandemic, they did suffer discrimination because of the risks they were subject to. People were scared that they would bring the diseases home and contaminate others. And they themselves were also very scared of taking COVID-19 home to their families and relatives. An important number of healthcare workers have died. A approximate calculation, even though there are limitations in this report, but estimated by the World Organization of Labor and WHO, the estimate would be between 80 to 180,000, 115,000 healthcare workers that died, and that should be discounted from that will be discounted from the already deficient numbers of basic healthcare workers. In the Global Assembly of the United Nations, to be able to reach the sustainable goals of the millennium, there is still a lack of 18 million healthcare workers by 2030. As was mentioned, the pandemic affected healthcare workers globally. It affected their health, it affected their social well-being and their families' well-being. There were insufficient labor conditions in the beginning of the epidemic, and in most countries, there was a limitation in the amount of healthcare workers available because of the demands that were being made of healthcare workers. They had to go beyond their psychological and physical ability. With this impact severely impacted things, causing burnout and affecting mental health. On the other end, the pandemic
and in the sanitation policies for human resources. Pressure and institutional stress generated by the sanitation emergency made everyone think about the need of valuing institutional capacities about the existing structure that were useful to respond to the COVID-19 pandemic in most of the countries of the region. the structures that we already have, we understand as management capacity, the existence of laws, regulations, and norms. And we can say that the response was more effective and opportune in those countries in which already had management teams that were consolidated and strengthened. A great challenge was the planning and the calculation of human resources allocation for health, for which we needed information and data, as mentioned by Kasum. Most countries accelerated for this consolidation of information. We could see that although many countries had information, they were partial or they were fragmented and dispersed. It's necessary to work on improving the number of healthcare professionals and especially the appropriate distribution of them. Very few countries right now have sufficient enough healthcare professionals to cover the needs of meeting at least 25 by 10,000 inhabitants in the regions, and not enough for those to have 44.5 to 10,000, which is the global objective for 2030. Many countries have put forward incentive programs for healthcare professionals during the pandemic. However, we believe that it is necessary that this results in improving labor conditions in a stable and durable manner. Effectively, many countries in the region improved the funding of human resources during the pandemic. However, it is necessary to have a close follow-up to ensure that the financial improvement was good enough to strengthen the healthcare system and improving a stable number of healthcare workers, which was not just a temporary policy to respond to the pandemic. A theme that became very strong during the pandemic was mental health. Almost all of the countries manifested the importance about the accessibility to healthcare measures and to have measures to reduce burnout, the excessive work and other things. However, not many people have invested in the medium and long term. We cannot forget what is very common in our countries, in our region, which is a lot of jobs as a consequence of very poor working conditions. Still outside of the pandemic, we need to remember that we have to ensure health and safety for the healthcare professionals, and we have to ensure the availability of vaccines for the healthcare professionals. It's important to consider equity, given that there are information that in a few countries, only 1 out of 10 healthcare workers are vaccinated. And in others, more than 80% of the healthcare workers are vaccinated. A theme that is discussed, that has been discussed for a long time, and that in a certain way the pandemic facilitated, is the intersectoriality. The discussions in the healthcare, together with education, finances, and labor, to agree with all of these sectors that they should talk about human resources and discuss how many professionals should come out of the universities and what is the job market available, so that we can create interest, spark the interest of people in becoming healthcare professionals. And we also need to thank the pandemic in a certain way, because many countries accelerated and improved bureaucracy in terms of the jobs, allowing for the mobilization and hiring of healthcare professionals. We need to see if this is a positive effect that it's going to be maintained as lessons learned, and that should be worked in a more efficient manner in all of our public healthcare systems. And to conclude, the pandemic showed once again that the best strategy to ensure the access and universal coverage of healthcare by keeping the essential services in addition to reducing the impact of the pandemic for the institutions of high complexity, is the strategy of primary healthcare and the establishment of healthcare services integrated network. We should work so that the first level of attention, which was hit hard by the pandemic, count on enough human resources that are well-trained and have the best working conditions. Once again, I'd like to thank everyone for the invitation, and also thank the presenters who spoke before me and who showed the global context and the local context in the country. Although we need to consider that Brazil, more than a country, seems like a continent, so large that it is. So thank you very much once again, and I pass the floor to Karen once again. Thank you.
Thank you, Dr. Cho. Appreciate that wrap up and focusing again on key messages, and as it all comes back to primary healthcare and the need for healthcare workers. Isa, Ida, I believe Isa, you're going to be. We have time for a few questions, and you're muted right now. Perfect.
Recebemos duas perguntas, doutora Karen. A primeira.
We have two questions. The first one, the pandemic is de-accelerating. So I'd like to ask, what is the role of the health techniques in controlling the pandemic, and how much technology helped the healthcare workers in the front line to combat and fight off the pandemic? Another question now. What is the role of the fake news in the development of the pandemic?
All right. So the role of health technologies. Kasum, would you like to take that?
Thank you. I think this is a very, very important question. We've been working in strong collaboration with the digital health group because it is an important element of the response, not only for making the use of really the distance learning approach to facilitate the training of the health workers, but also on the testing, using the remote approach to delivering results. You all know that when you are traveling, you need a PCR test, and then these are delivered by email now or by WhatsApp. So it's important that the digital health related approach is taken into account, because it makes life much easier, and it helps also the collaboration. Sharing experience also is another element of this digital health. How do we make sure that the things that are working well in other countries are shared very quickly to other countries? Distance learning, the use of digital health in supporting not only the testing but also the sharing of information. All those are important elements that needs to be taken into account. On the second question on the fake news, quickly before maybe my colleague from Dr. Marcelo Marquez can reply. That shows the importance of good data. You know, people can just give you a number there, but if you do your own assessment, and then let's understand that assessment is not just for sharing data with PAHO or with WHO. You do your own assessment for using the data for your own policy and your own plan first. So if you have proper data and you conduct systematically some assessments, you reduce the possibility of fake news. And that's what is important there. Fake news can be there, but as long as you have strong data to support your statement, as long as your plans are based on evidence, you're reducing the negative impact of fake news on that. Let me just stop here for the sake of time, but those are some of the thinkings that I had on that. Thank you.
Thank you, Kasum. And I think some people would argue that the data is part of the fake news itself, right? it's very valuable.
You need to do proper data collection and analysis, of course.
Right.
Yes.
Dr. Marquez, do you have a comment on either related to Brazil?
Bom, primeiro falando sobre
First of all, when we talk about the role of technology, well, actually, it's even difficult to add anything else after what Dr. Kasum mentioned, but I'm going to try here to bring this to our reality here in Brazil. Apart from what he mentioned, apart from a more agile communication that technology allows for, the faster advance towards finding a solution for the pandemic, I believe that for us, specifically here for human resources and health, the remote education was an excellent tool for us to be able to provide capabilities for these healthcare workers and how they would deal with the sick people during the pandemic. So this was a very important and strong tool, making it possible for us to, even though we were distant far, we were able to provide capabilities for these healthcare workers, as well as qualifying the services being provided to the patients. Now, regarding fake news, also following the same line of thought that Dr. Kasum presented, I believe that we always have to base ourselves and be careful on what is reproduced, always be based on facts and evidence. And then we go back to what Dr. Monica mentioned in the beginning of the event, that we must have quality of data to which we have access to, and from there mitigate or even end the fake news issue, which is now a current global problem.
Thank you, Dr. Marquez. Dr. Cho, did you want to add any comments?
Sí, muchísimas gracias, Karen, y muchísimas gracias.
Thank you very much, Karen. Thank you very much for the comments from Marcelo and Kasum. I'd just like to comment on the fact that the theme of telehealth is something that before the pandemic, we already started working with that. And what the pandemic did was accelerate the process for the quick implementation of telehealth systems and also consultations. However, there's a regulations and normative component that needs to be revised in the country, in the sense that very few countries have regulations so far and have regulations in place for telehealth and for these telemedicine. And so the responsibilities of people who provide these types of appointments, doctor's appointments, and when you talk about medication and treatment given by means of these measures, all of this needs to be regulated. With respect to fake news, we talk a lot about fake news in general. And at this time, you know that even Facebook is facing lawsuits for that. However, if we focus on health professionals, there is an important percentage of healthcare professionals who have not been vaccinated precisely because of these fake news. So what we know is that training and education and real information to all of these healthcare professionals, as was well said by Marcelo and Kasum, with serious, correct information based on scientific evidence, all of those are very important so that we can protect those healthcare professionals. Thank you very much, Karen.
Thank you, Dr. Cho, for emphasizing again the need for education, accurate data, and to share that with the right people. Idai, is there, I know we're at time, is there one more question or should we?
Sim, temos mais duas perguntas.
Yes, we have two more questions, but due to time, we are going to mention only one. So here we go. The technical workers in the healthcare sector many times are not seen in the process of work. In the pandemic context, it wasn't any different. There are is there project research that focus specifically on these workers?
So the question is, where are these workers? They're not shown up. Where are they in the statistics? Where are they in the field? Do you have any comment on that? You want to start, Kasum, with the data on technical workers?
Yes, in fact, when we do our assessment, we hate the word frontline workers because people tend to think it's just those who are in direct contact with the patients, and then it has a different connotation like the others are backline workers, and this does not exist. The response to COVID is done teams. You need those people who are medical doctor, nurses, pharmacists, technician, lab, etc. All those people compose a team, and those people are in all our estimations that we are doing. We are thinking in terms of the teams of health workers. We don't do estimation for one specific occupation. We do estimation for the teams, and this also depends on how countries organize their teams. And that's also very important. But this is a common thing. People tend to think about, we are only looking at medical doctors and nurses, but we are looking at the teams in general. And that's also, even for the vaccination, it's not only doctors and nurses, you have many other people who are involved in this process. And it's important that we keep thinking in terms of teams rather than this specific occupation, or these are frontline, these are backline workers, and etc. Thank you.
Yes, I know it's very much a part of the National Health Workforce Accounts, the information
exactly.
about the health technicians. With that, Dr. Marquez or Dr. Cho, do you have any further comment about the health technicians and their role in pandemic?
Bom, como é sabido, os trabalhadores
As is known, the technical workers from the health sector end up at some point staying in the shadow of the doctors and nurses, but we do the best to give visibility. We even have coordination with a specific work that work here within my department, within the Secretariat, the Bureau. And when we suggest this action to work in the emergency within the health sector in a broader sense, we also think about those who are in the ambulance, the mobilization technicians, and other health technicians that are within the technical realm, but are part of this network and are essential so that we can qualify the services so that it reaches the users. Also, they were also prioritized in the plan here for deployment here in Brazil, because they work not exactly in the healthcare provision, but they work in cleaning, for example, and other types of work that were very tough during this period.
Yes, to add to that, we consider that in the package of healthcare workers, technical experts, or the technical group, covers more than 50% or more. Even considering healthcare professionals, we consider that nurses cover more than 60%, above the amount of doctors and other professions in health. The problem that we have been facing regarding the technical teams is the definition of these groups. We also have some trouble defining the healthcare workers, domestic healthcare workers that are not being paid. So how are they cataloged? How are they categorized? And how does this information exist within the information system regarding the team or that group of healthcare workers.
Thank you, Dr. Cho. I know we have reached the end of this panel. I wanted to say, first of all, thank you to our panelist and commentator, Drs. Diallo, Marquez, and Cho. And thank you to the participants and again, the organizers. And I'd like to, if I could, close with a comment from the joint statement from the Steering Committee on the International Year of Health and Care Workers, because I think their comments are very relevant to what we're doing today. The world cannot recover from the COVID-19 pandemic without long-term sustainable investments in the people who provide care to us. And recognition and commemoration are not enough. It is our moral obligation to protect and invest in health and care workers, and we must move forward together. With that, I want to say thank you, and we'll move on to the next panel. Ida?
A organização do evento parabeniza e agradece os
organization of the event would like to congratulate and thank all of the participants in the pandemic. Now we are going to have the table, Impacts of COVID-19 in Brazil. And as a coordinator, I would like to invite Dr. Jorge Eliano Ramalho Filho, technical advisors of the Health International Issues Advising Committee. Please, Dr. Jorge, the floor is yours. Good morning, everyone. First of all, I would like to thank the organizers of the event for having invited me, especially Ana Paula. And now we are going to start the second panel of our event, and it is going to address impacts of COVID-19 in Brazil. And we are going to have 4 experts taking part in it. And Dr. Monica, she's going to be the moderator. The first lecture will be mental health and the Brazilian healthcare works, which is going to be presented by Professor Ana Paula Souza Vasques. The second one will be Professor Dr. Maria Helena Palucci about impacts of COVID-19 and conditions of work and of Brazilian healthcare works, and then the role of public healthcare schools in training professionals by Dr. Asioli. So now I'm going to pass the floor to Dr. Ana Cláudia Souza, who is a professor and doctor and the dean of the Healthcare University of the city of Porto Alegre, and she coordinates the nucleus of study of positive psychology in labor. So, doctor, the floor is yours. I am going to raise a 5-minute sign before you finish your presentation. Thank you, Dr. Jorge Ramalho. Thank all of you for being here, and the organizers for having invited me. And I'm very proud to share with you our research and experiences. I'm going to start sharing my slides with you. So the topic that I'm going to share with you is related with research that we've been performing in the nucleus of positive psychology in health and labor issues. It is a specialized topic. It's the only place in which we have been, it's the only university that has been focused on this topic. I'm going to share with you some data and sharing you information about the university. And if you feel interested in knowing who we are, who we work with, we have websites with the protocols and the practices that we implement based on research studies. There's a book that is available that shows 6 protocols for mental health focused on COVID, and it was produced in combination with important institutions that deal with positive psychology, and it's based on risk factors and protection factors. So we have 6 protocols of support, protocols of specific mental disturbances, specific protocols for healthcare professionals, and the protocols for those who have lost their family members. And we also have a protocol of initiatives that we performed in the university, because many of the members of the university work in hospitals. So we created a well-being protocol based on analysis of risk factors. So if you want more information, you can download the book. This is our team. It's an international network formed by 26 countries, and we always perform applied research. I would like to thank Professor Clarissa Freitas, who helped me a lot, and today she really helped me in different analyses. I'm going to share with you data collected in different times before and during the pandemic. First of all, the first thing that I would like to share with you is that mental health acquired a different level with pandemic. COVID-19 brought us many challenges and brought us a very clear idea that we have to think of health in an integral, as a whole. Mental health is fundamental for our physical health, and it's especially important for healthcare professionals. And I studied, caught my eye, was by Packet. It was a landmark. It analyzed more than 62,000 patients. They verified for 90 days the impact of the mental impact of patients who had COVID-19, and they included a portion of 20% of patients who had, as a consequence, an anxiety, depression. The study was published in 2020 November, but the data came from the beginning of the pandemic. So there are many studies that bring this reality closer to us. It's important to point out that in February 2021, we started to have contact with the data from the Ministry of Labor, from workers who had to leave due to mental disturbances. People had to leave work due to mental disturbances, and we also saw an increase of 33.7% in the number of people who were depressed. And we also had an increase of 20.4% in retirement. And from 2018 to 2019, the increase of, for example, retirement was 2%. So studies have shown that the context of the pandemic posed a huge challenge. And based on our studies, we saw 3 results of the pandemic with regards to mental health. The first one is related to our own relationship with regular mental disturbances like depression, then the use of psychoactive use and the use of other drugs and other issues related with poverty and lack of good conditions of living. We have the result of uncontrolled transmission, and this varies from one country to the other. And since Brazil is a huge country, we have different regional differences. We had isolation of positive patients and the way in which families dealt with patients who had to go to ICU, and then the issue of grief, because in Brazil we had more than 600,000 cases. And then the relational effect is the third sphere that we used to create strategies to face the pandemic. And we had different strategies, regionally speaking, and different strategies in different cities. The families had to restructure themselves. We had remote work, lifestyle changed. We had what I call relationship overdose, people who had physical distancing from others, but at home we had an overlap of roles. So I am a mother, I have children, and I have to be a teacher, I have to conduct research. So we talk about this overlapping of roles in time and space, the fear of COVID, and then fake news, which is something that we have already addressed. And also the excess of information and what generates ambiguity and insecurity. So within this concept, we have long COVID. I'm not going to deep dive in this topic. This is a broader concept, and I want to focus on healthcare professionals. But I would like you to pay attention on what is written in red. The items in red are related to mental health. We are talking about post-traumatic disease and anxiety, depression, sleeping disturbances, and we have here among the different analyses and evaluations an assurance that is the need to create an international policy addressing mental health of healthcare professionals globally. We need to offer psychosocial support. There are issues related with cognitive aspects and patients, and we need to offer training to address this. We have to support recovery of COVID-19, including mental health services. This study performed by KFF USA, it focuses on healthcare professionals, and it raises some issues that they have been able to evaluate from February to March 2021. They talked about too much sleep or lack of sleep, headaches, stomachache, increase of use and abuse of alcohol and drugs. And we saw something that was preserved for USA workers of 56%. Only 13% received mental care, and we have different studies. These are international studies, and they show that what was foreseen by target studies in the United Kingdom, they detected 40% of problems, and in the US, 41%. So we have symptoms of anxiety, 35% of the professionals, 28% of the professionals have depression, and 41% of healthcare professionals have both. And here, with regards to essential workers, we have the similar data, but what caught our attention the most was the last one. 22% of essential works, including healthcare works, the people who seriously thought of suicide. This is information that we have to be aware of. Another piece of information that is important to share is related to gender, specifically talking about female. We saw an increase in violence against women because they were at home, and we also had racism, the fact that they lost their jobs, inequality in terms of jobs and wages. And these differences, they got worse during the pandemic. And here in Brazil, most of the healthcare professionals are women, so there was a huge impact in this sense. So what we've been detecting is that in order to think of healthcare of professionals, we have to develop prevention strategies. We have to think of protecting psychosocial aspects that promote mental health. So we have to think about the determinants of mental health. We need data about it, and we have to know what makes people maintain their mental health preserved. This is what positive psychology studies. Of course, every one of us is impacted somehow, but there are some people who are able to deal with it in a healthier way in comparison to other people. So we have been focusing on this. There are many different symptoms raised by international entities, and what do we have to pay attention to? Change in appetite, difficulty to concentrate and make decisions, difficulty in sleeping, physical reactions like headaches, stomachache. All of these things have already been identified and have to be addressed. And the data of burnout is connected to this international study. It is called Burnout Assessment tool, and it's a study that was conducted in 26 countries. Here you have all the data and all the articles that were published. Professor Vilmar Schaufelli is the leader of the project, and we work with two types of seconds, primary and secondary symptoms of burnout. So we are able to make clinical evaluation of the patient. And we have patients that are in a moment of alert, they are orange, and we have patients that are red, those who are in a chronic situation. So now I'm going to share with you the research studies that were performed in 4 different times, 4 times in 2019, twice in 2020, and 1 time in 2021. So we had 4,022 healthcare professionals and specific healthcare professionals during the pandemic, 1,098, and before the pandemic, 76. And there were many studies, and a very important piece of information. I'm sharing with you the important data. There's a difference. You can see that all of them are interesting and important before the pandemic and before the pandemic.
Temos uma diferença grande entre
So we have a large difference among the people. Here, you can see that before the pandemic, the average is much lower than during the pandemic. And this difference is associated to the anxiety symptoms and depression that these people suffered. So we have severe symptoms of anxiety and depression, the symptoms from depression that go from moderate to severe in 56% of our professionals, and also 3% of suicidal symptoms. To deal with the stress of the pandemic, 30% of these workers went up their intake of drugs and alcohol. Many of them started overeating. Some of them were able to keep a healthy lifestyle with sports and everything. Others started using psychoactive substances with a prescription. 14 used these substances without prescription, and 11% started some psychological treatment. Although some of these workers noticed that there is some positive change, most of them believe that the pandemic brought negative changes associated to their professional work. Regarding the burnout, I'd like you to pay attention to this. It's really important. 52% of our professionals in the healthcare have high exhaustion symptoms. And these are people that are going to be on leave. 21% are in the orange and only 27% in green. So this is a serious scope. We have 58% in exhaustion, and this has to do with the situation that they are reviewing. They are somehow already on leave, and this generates harm to the worker themselves, but these are the two variables that we measure. And we notice that cognitively they are well, so their capabilities, qualifications, and protocols are taking effect, and this hasn't affected them. They can still work, but it's complicated because these are people that can work, they continue working, but they are going into chronic states. And there is some management of the psychological factor, and the tendency of this of getting worse is high. The understanding that these symptoms are associated to the quality of sleep is actually bad, their quality of sleep, and they are more worried about their physical and mental health state, and affects their mood and burnout. The last slide that I'd like to share with you is that when we ran this assessment, we looked at protective factors that were associated to burnout. What can protect us from this? Does the satisfaction with their overall well-being, is it associated to this? This is a study that we have already carried out before. Before the pandemic, we can clearly see in this first picture that yes, it does protect. Those who are happier in their lifestyle have a less tendency to develop burnout, but what is clear regarding the rules is essential. The control over their own work is also essential. Their satisfaction with work also, but this has generated harm to them, and also the support that they get from the team, this is intermediate. What we observed during the pandemic is that this doesn't work anymore. What happens is that we see that burnout is now not only in work, it's the entire social context. It's everything that's happening all around them is generating exhaustion. And this distance mentally as a protection measure which is not healthy but is necessary, and is creating emotional conflicts, which is also going to create in the near future cognitive issues. So the society, everything that's been happening, how we are facing this, maybe in the specific areas or in general, has affected these workers' life. And now, to finish, there is no difference between our data, between the professionals. It doesn't matter if they are doctors, nurses, physiotherapists, it doesn't matter. They are all suffering impacts during the pandemic, and they all meet these symptoms and are severe. There is no difference, just as there is no difference between men and women, although most of our sample is female. So they are all actually associated. We do have higher burnout in the healthcare work sector because of physical, psychological, organizational demands and the protective factors we have assessed, but they are not enough so that we can deal with this and face it. And they have gone over the institutional walls. So we need these policies that have been presented in this panel previously. I'd like to thank everyone, and I'm available to Q&A. Thank you very much, Dr. Ana Cláudia, for your wonderful presentation, the data that you presented. Yes, we do have to take care of our healthcare workers, mainly in the pandemic, but not only in the pandemic. Due to time, we're going to pass the floor now to Dr. Maria Helena, who is a professor of the nursing school in Ribeirão Preto in the state of São Paulo, Brazil. She is a nurse specialized in work nursing, and she is a professor in the postgraduation nursing course, and she is a member of the committee of the WHO for research in nursing. As I mentioned, she'll have 15 minutes, and then at the end, we'll have Q&A. Thank you. Now the floor is yours, Maria Helena. Thank you, Dr. Jorge, for the presentation. I'm going to start with my presentation. That way I can start. Do you see it? I think so, right? Yes, we are. Thank you. Well, I'm bringing the first results that we had in our project, COVID impacts in the work and health conditions of the healthcare workers in Brazil. This is a project that was developed with several parts, with the PHO. The entire team participated, the team from Ribeirão Preto's nursing school, with the involvement of a collaborative center, and the participation of the Ministry of Health, with the representation of Marcelo, who have been working with gathering the data. And this data is now part of the study, but has as its objective not only the study, but also bringing support and basis to broaden the discussion on this topic, so that we can, in an intersectoral way, work on these issues, not only facing the issues that we have now, but also the ones that we will have post-COVID. So I'm going to start my presentation. Here is a general topic regarding the pandemic, how we're facing it, the results from the Impact project through its two different phases. The first one, which is where we gathered scientific evidence and the impact of the pandemic in Brazil through a scope review, because we have to always keep working on all our actions from scientific evidence. And this is a recommendation that everyone should follow. And here in Brazil, we couldn't be doing it in a different way. The COVID impact, according to the occurrence of infection and deaths among healthcare workers, among the registers that we have in the open data banks here in Brazil. And in this way, contributing to broadening the discussion. Well, the pandemic brought, as we all know, difficulties for the services in the health sector. In Brazil, we already had issues regarding distribution and human resources in the health sector, and difficulties in some of the areas of the country. Also infrastructure issues, and the issue of their qualification. These issues got worse with the pandemic, and also due to the high transmission factor that the virus had and how to deal with it in the beginning. And we are still facing some difficulties regarding this aspect. A lot has been discovered, a lot has been applied to this, but still we have some issues to discuss. This set of factors resulted in a high rate of infection, and these people sought the health services for the services that are provided by healthcare workers that also got sick and died. So here is the results of the epidemiological report, which has a date of September 20, 2021, in which we had over 146 cases, confirmed cases of COVID. And of these confirmed cases, the technicians were 29% of the representation of this data, nurses 17%, and doctors 10%. But as mentioned, this team is much more than this. It is composed of other professionals who we are also working with, but in the registries that we have access to, some professions are harder for us to gather the information. So we focused this presentation to these 7 categories that I'll be mentioning next. I'd also like to mention that this entire set was an alert so that the public policies would look to the strengthening and broadening of the health services for medium and high complexity, having broader infrastructure and equipments, not only for these professionals' work, but also regarding resources. And also it wasn't enough. And we have to look at the essential services that are provided, which is the entrance into the universal system of health, which is a primary support to health, and their integrated network, which was mentioned previously, of how important it is to make this first service stronger, not only to fight off the effects that we're having from COVID now, but also in the future that awaits for us. So in our project, this is this group of work. There are several people here who are mentioned, and there has as an objective assessing COVID's impact in the work and illness conditions of the healthcare workers in Brazil through epidemiological data and scientific evidence. We've worked with a study method that is a multi-method design, and it involved a first phase, which was the scope that we had to review, and the second, the study of the epidemiology. But both were done at the same time. At the first stage, we mapped the scientific production regarding work conditions and physical and mental illnesses. Physical illness is the infection due to SARS-CoV-2, and how mental health issues related to stress and burnout. Regarding the methodology, we followed all the recommendation, And we used the protocol PRISMA to review the scope. The question here is, how do the work conditions impact physical illness and mental illness of the health professionals during the pandemic for COVID-19? And what were the strategies used to mitigate these illnesses? The methodologies are more specific, I won't go into, but I'd like to say that there was an answer from the Brazilian researchers, and our data comes only from the Brazilian researchers, in which we had an answer of 2,445 articles published internationally and nationally, then 368 productions that were listed and we call as gray literature for the servers in preprint, but also in the website of the governmental agencies and other professional agencies, such as the class councils. Regarding criteria for exclusion and eligibility, basically, we remained with 149 articles, and then they were integrated to our assessment. As preliminary results for the study, we can see that on September 18th of 21, 228 or over 228 million confirmed cases around the world, and Brazil stands on the third position in terms of numbers, only behind United States and India. This brings an alert and diagnoses regarding our epidemiological conditions, but also economical and structural conditions in the healthcare system. Regarding deaths, Brazil is in the second global position. This is not a position that we would like to occupy, but that's why the intersectoral actions are very important so that we can leave this position. Healthcare workers that were in the front line in contact with the population were frequently in contact with the infection, but not only them, just as Dr. Hassan mentioned, the ones that are part of the team, the health team, those who are not of the health team specifically, but support it. A large research run by Fiocruz here in Brazil resulted in 50% of the healthcare workers are overworked with shifts that are over 40 hours weekly, and many of them have more than one job. And this only brings more difficulties to these professionals, which brings them to the exhaustion, mental exhaustion state for these professionals who are dealing with COVID-19. The fear of contamination and death, which is all imminent, is also an issue that we have experienced in our daily lives and in literature, how important it is and how much we need safety at work and their action for these professionals. So the question is, why are they scared? If the working conditions are proper, would they have less fear? My answer is yes. So here we have several researchers who prove to us that the working conditions for these professionals in Brazil is marked with a lack of human resources, bad working conditions, and the lack of protective measures, both individually and collectively, the lack of norms and protocols and biosafety, overwork, and the lack of information, of support procedures, the need to create new organizational flows, non-availability of tests, PCR, for example, and also for personal protection tools and devices, not only regarding the quality, but also the quantity. And we saw Marcelo showing us the government's strategy to mitigate these issues. Now here, health is being affected both physically, and in this aspect, I'm going to bring you the results of how many of us were infected by SARS-CoV-2 and have become ill due to COVID-19, and also the severe respiratory syndrome. Mental health has also been mentioned by Professor Ana Cláudia. Burnout has always existed within the healthcare workers as a cause of absency and not being present. In other words, professionals that are not in their full capacity, but still they go to work because they need this job. And that's a problem, a very serious problem. And with the pandemic, this issue has brought even larger numbers of absentees. I'd like also to bring our national indicators for absentees, but we don't have this register in our databases that were consulted. So the political strategies that were adopted to mitigate the issue according to literature, and keeping in mind that everything that I'm talking about here are the summarized results of the studies that were published in the last year. So here we have as a strategy the creation of protocols for new flows and conduct with proper logistics and training for the use of personal protection tools and the flows within the working class, as well as the flexibilization among the work shifts and the recovering of health, the follow-up also of the cases of those who are on leave. This is very important. Adaptation to the new routines, the capability of healthy routines and safe routines for the worker. So if the worker does not have safe conditions to work, they will not be in a comfortable way, and consequently, it will have negative impact, which is their product, which is the support to the population.
We have measures to avoid high-risk behaviors were established. We also hired new employees, and we saw how this was done. We saw the need for greater and better training of professionals, especially those who are going to work in the ICUs, as well as in the pre-hospitalizing service, let's say so. The strategies used in Brazil were vaccination that is started in the 22nd of 2021, and we know that we've been having a huge increase in the number of people vaccinated. I'm talking about a large number of people. Our public health system operates vaccination in a very efficient way. We also had workers testing in many different areas of the country, but in some more remote areas it was hard. We also had Brasil Conta Comigo initiatives that Marcelo shared with us. But one thing that was very important for healthcare workers was an update of occupational diseases, including COVID. This was a huge debate, and because COVID-19 is considered a labor accident, and then workers would have legal benefits. In the second stage of the study, it was an epidemiologic transversal study. We analyzed indicators of SARS-CoV-2 and deaths caused by COVID-19. The data is from February 2020 up to July 2021. First of all, we are going to talk about the infection by SARS. among healthcare professionals and the flu syndrome. So we had more than 1,900,000 cases, and we used data SUS and ISUS Notifica, which were sources of data, and we know that some cases are excluded from this figure due to different factors, but we analyzed more than 1 million healthcare professionals, 1,032,955 professionals. So the data is related with nursing technicians and auxiliaries, doctors, physical therapists, pharmaceuticals, and radiology technicians. The analysis took place between March 2020 and July 2021. And nurses represented 23% of infections. Among technicians and auxiliaries, we had 46.1%. Among doctors, we had 16.6%. Physical therapists, 4.5%. Pharmaceuticals, 4.5%. Odontologists, 5%. And radiology X-ray technicians, 0.5%. The distribution of those healthcare professionals from February 2020 to October 2022 is as follows. Among the total number of professionals of each category, this data was provided by the Ministry of Health, for the project. So nurses notified that nurses who were identified with the infection, confirmed cases from 355,000 patients. We had a number of 237,000 who were infected, representing a total of 20%. Technicians and auxiliaries, nursing technicians and auxiliaries, we had a 13% of infection. Physical therapists, 31.2%, pharmaceuticals, pharmacists, 28.8%, odontologists, 25.2%, and we had a total of 31.4% professional healthcare infected. We have the distribution of infection by SARS-CoV-2 divided by regions. The southeast is the area that was affected the most in terms of numbers, but in the northeastern and northern areas of the countries, there were huge difficulties due to the lack of professional healthcare professionals. And we had 31.4% of our professionals who were infected. So the profile of the Brazilian healthcare professionals who were infected according to gender and age. This is important data because in Brazil, healthcare professionals are mostly women, And what we see here, and with regards to infected healthcare professionals, with 77.5 of them were women and 22.5% were male. And when we check age, we can see that the average age range was 39 years old. And we can see that here in Brazil, we have a number of people who are females with a different distribution in comparison to males. We saw people with older age in males, and this influenced the cases of death. Here is the notification of the flu syndrome. We can see the curve. At first, from May 2020 to August 2020, there was a peak, and it has been descending up to today. So the cases have been dropping. And so far in the country, the cases have been dropped. Have been dropped. Here we have the confirmed cases. We had a huge high peak from April to 2020 and September to 2020. And then from December to February, December 2020 to February 2021, another smaller peak. Now, with regards to severe acute respiratory syndrome and death of a healthcare professional, the preliminary results show that we had, just 1 second, let me just check. In our data bank, we used data from CVEP gripe as the source, and we also used data from the class committees, the COFAM from nursing, and then from pharmaceuticals, odontologists. So we had 17,000 cases to make our final analysis. And the number, 12% of the nurses were infected, and nursing technicians and auxiliaries, 20.5%, 45% of doctors, physiotherapists, 4%, pharmacists, 5.7%, odontologists, 9.6%, and X-ray technicians, 3.0%. And the nursing team and doctors were those who were affected the most. Doctor, we would like you to reach the end of your presentation. So death by COVID here in Brazil were 74.1%, and we had 10.99% of death, and the northern area of Brazil had the largest number of deaths. Here is what I mentioned about the difference between gender. Men represented 64.4% deaths, and women 35.6%. So we have more women working in the system and health. We have more men who died. And we saw that the average age range of men was higher, 66 years old for men and 54 years old for women. And here we have notification out of the total number, 3.37% of nurses that died, 2.75 of nursing auxiliaries and technicians, 20 doctors, 1.6 physiotherapists, 7.2 pharmacists, odontologists 5.5, and X-ray technicians 6.1. And in a total of all the healthcare professionals, 6.2 of them happened to die. So the pandemic showed problems and difficult situations in the system, especially up north, and inadequate work conditions contributes to professionals falling sick, and intersectorial strategies have to be used to improve working conditions of those professionals, as well as adjustments in human resources and in continuing education. On behalf of the entire group, I would like to thank all of you. Thank you, Dr. Maria Helena, for your presentation. Unfortunately, we don't have much time, and I would like you to apologize me for having interrupted you. It would be much better if we could have more time. But congratulations for your presentation. And now we are going to have our third lecture from Dr. Haroldo Campos. He is an expert in public health from the University of São Paulo, and he's the technical advisor of the healthcare department in Brazil. So now I am going to pass the floor to the doctor. Good morning, and thank you all. I am a worker of the Sistema Único de Saúde, Brazilian public service. And I would like to explain to you that I have a problem of time. We have a meeting today, and unfortunately at noon, I will have to leave to take part in this other meeting. So I will try to be the more objective that I can. My name is Haroldo Campos. I work in the public health system since it was created. This is my professional identity. I've been a coordinator of the public health school, and my entire trajectory has been in the public system of health. I was invited by Dr. Adrilia Padilha to talk to you about the role of state health public schools influence and importance. And to deal with a topic like this, I have to introduce you to two aspects, especially for those who are from abroad. These two topics are very well known here in Brazil. The first one is that we are talking about SUS, the Brazilian Public Health Sector Service. This is something that we've known for ages, and during the pandemic, the role of SUS has highlighted during the crisis. We are a continental country, and we are talking about a system that is organized in the entire country as a result of accomplishments after having faced really difficult political moments, which were the dictatorships. The SUS is extremely inclusive. It has a close connection with democracy, and it has 4 principles. The first one is universality, and the second one is integrality, and then equality and participation of society. So the system has been an example because it shows a new reality of public policy in Brazil. I'm not here saying that as of the system was created, everything got solved. I'm not saying this. The Brazilian population started having access to health, and for us, the concept of universal access to health services is central. It is completely different from what we had previously in the country. Another fundamental issue to understand what I'm talking about is that after SUS was created, many policies were created, and I would like to highlight the first one, which is what grounds the work of qualifying and training professionals. So this policy is the main strategy used by SUS to train and qualify and develop professionals. Everything that is related with the training, qualification, and development of healthcare workers is grounded by a policy that has as pedagogical concepts 3 important major aspects. The first one is a necessity to integrate services. I'm not talking about sitting around a table and discussing. I am talking about an invasion of qualification in the field of work. And I am also talking about availability of qualification based on what reality offers. And the third one means a significant, meaningful learning. What is the sense of what I'm teaching? So working and knowledge is incorporating daily practice to education. And this policy's objective goes beyond individual training. It aims at improving practices. So it's not only about individual practices. We are talking about work organization, and we are talking about work processes.
So 4 or 5 years ago, we started to work here at CONASE, which is the National Bureau of National and Local Secretaries for Health. This entity is prior to the SUS, the Brazilian Unified Health System, and they help the national system in health. And it's important to understand that it integrates the same system. So SUS, Brazilian Unified Health System, is the unification of these 3 entities in health, the Ministry of Health, states and cities. And from this point is the point from which I'm speaking, which is the perception of the state's bureaus of health. So within the scope, one of the things that I do here is to coordinate a technical committee that is an official representation of the 27 local health bureaus. Within this technical committee, we talk about the whole set of actions that will be carried out throughout the education sector and health sector. Within this technical committee, there are 20 state public health schools. From these 27 states, then 20 have a public health schools. It's also important to highlight at this point that we understand this set of schools, And there is also a definition about this, both in the federal constitution as well as the organic laws, 2842. There is a role that is not a role that competes and doesn't englobe the role that the universities have and its specific schools have. This is essential, but there is a whole set of specificities that should be treated and referred to by these schools, which are also associated to the health secretariat of each state, but they're all associated to these local boards. Another thing that should be highlighted here in this current presentation that I am carrying out right now, all of them were developed with tight partnership with the Pan American Organization of Health, and in this specific case, represented by Monica Padilla, who just turned on her camera. And I'd like to say that we are at the same time happy and sad. Happy because we carried out this very strong project throughout these years, but sad because this WHO and PAHU might be good for PAHU, but it's horrible for us. And so Monica is leaving Brazil. We won't lose contact, but it's not the same as having Monica here with us working side by side. Now, within this technical committee, when the pandemic started, we were all caught by surprise, and the impact was really immense. And I highlighted Anna talking about impact. It was impact for everyone. For you to have an idea, March of last year, we had a meeting at CONASE to prepare ourselves to the pandemics that are to come. And we all work in the health sector. And even among us, it reached us faster than we could even imagine. Here in Brasília, the first cases that we had, due to the characteristics of our job, was in CONASE, and the first death was also at CONASE. It was Vivian, a nurse very dear to me, and she was taken due to COVID. So here, the impact was immense, and it made us realize that we would have to relearn many things. One of them is, how do we deal with, apart from all these effects that have been presented here, the impact that had the workers suffered, how can we carry out our activities considering the impact and the need for a project that needed to follow the characteristics of social distancing and commuting? This was a worry. And within this, we developed two projects with PAHU. One of them was to deepen the capability providing of these workers from these schools to develop distance working, remote working, both with the virtual campus of the healthcare school, which was important for the capability providing of technicians and pedagogical teachers, professors, that would use this tool. It's obvious that it's not the same as being in the classroom. And here I'm not talking specifically about the health area, but that all things can be done remotely. Not all things can be done remotely. And it's important that we also have another area that we are always paying attention to. And there are some people that defend the idea that all things can be done remotely, even the undergraduate studies. This is absurd. And I'm not talking about all of these, but a whole set of actions that can be carried out and developed, and our workers were not properly prepared for. So we located and created this activity to deepen and prepare these workers to work in this area. And the other project was to gather a whole set of quick courses that were already organized by PAHU and other entities also had, and that these schools start presenting. Here, there was an important take from this, and many of these activities were reorganized or customized, as some people like to say, from the reality of each state. So they would take a whole set of courses that were focused on the pandemic reality. They would reorganize it in a presentation format, and the activities were carried out in each of the states with a very high participation. One of the takes from spin-offs from this action was that we are almost being able to put together, and we have here one assembly a month at CONASE. All the secretaries come over. During the pandemic, they didn't. Now that we're in this a little bit not as bad situation, because I don't want to call it a good situation, honestly, because daily over 300 people die a day. This is higher than any pandemic that we have ever had here in the country. It's worse than the most serious period of dengue that we had 3-4 years ago. And because the standard was over 3,000 a day, I don't think that we can say that over 300,000 Brazilians dying a day. I think we cannot say that the pandemic is controlled. It's not. And especially when we talk about who are these people that are still dying. Still, the situation is not the same as before. Now we have in-person assemblies, and the next one, November edition, we will officially be launching a new network of public health work schools that is going to be put together by the whole set of state schools, a collaborative network with the characteristics that I mentioned, and also has this front. Another thing that's very important to mention, has a very strong participation from PAHU, a partnership that we have, was the whole set of data of the workforce that we have in this. It's not obvious as it seems for you to gather minimal information about workforce in SUS, the Brazilian Unified Health System. We have put a lot of effort into this. We have some panels that are ready and bring this information and education in a very agile way with the most advanced technology that we have, the information regarding the workforce within SUS, where they are, who they are, what they're doing. It's obvious, but we still had and still have difficulties finding the information. That's very important to mention. Now, lastly, I'd like to reflect on this the year very briefly, really, about the International Year of the SUS health workers. We participated in the organization of this event, the creation of the document. We signed it, and the decision actually has many spin-offs to it. Yesterday, I participated in an event in the state of Pernambuco, which is a spin-off from this International Year. Now, what I'd like to pick your brains on is something else. If we still need to fight in order to create space and highlight the healthcare workers, it's because the support really doesn't exist. It's because the situation is still of a lot of invisibility. Do not raise that sign. I am about to finish. Okay. Now, so when we do that, it's because we still need to go for this information. When I say SUS is important, it's because it's still necessary to mention that it is. And then when it has difficulties, it's always threatened, as it is now. And when you say that the workers are important, it's because they are actually not recognized as important people and workers. And that's why we do our work, and that's why we'll continue doing so. And lastly, I'd really like to invite all of you to participate in the CONAS communications and publications. They're all public, and you can find them in our website. We have several. There are many consultants that work with them. They're all free for download. I have mentioned only the health education aspects, but you'll find many different things that were published regarding the challenges that SUS face and the qualities that might help somehow. And I apologize to have spoken so quickly. Usually I don't speak so fast. I'm from the city of Ceará, and you know, I usually speak very paused, but I had so little time, I had to do this. I'm only going to listen to Monica sing because I do not have the courage to leave this meeting before she speaks, but unfortunately I'll have to leave before the debates because I have another thing going on. Thank you for the invitation. Thank you, Dr. Haroldo Pontes. Your participation is extremely important. You've always been together with everyone in all the discussions. I do apologize for the short time that each one of you have, not only for you, but everybody else who has participated in this panel. Now I'm going to accelerate and pass the floor to Monica. All of you already know. She is an Ecuadorian doctor, and she works with an investigation in the Ecuadorian Public Health University, manages public health assessments at the school through Fiocruz Brasil, and she coordinates the unit for capability providing and the unit house of the Pan American Organization from WHO. Now the floor is yours, Dr. Monica. Thank you so much once again for the invitation, for being here.
Eu também tenho assim umas emoções muito grandes de ter que sair e também ter que mudar a outro país, mas também uma gratidão imensa desta possibilidade de compartilhar com vocês e obviamente ficar em contato, porque uma vez que uno está no Brasil, a gente tem em conta muito a potencialidade de trabalho conjunto que se estende a toda a região. De fato, o Brasil sempre foi referente de trabalho e uma força para poder impulsionar, sobretudo em muitas áreas, mas na área de gestão do trabalho e educação, sempre liderazgo, a liderança do Brasil na região tem sido reconhecida e procurada. Eu, por o tempo, vou fazer comentários curtos, porque acho que a riqueza das apresentações são muitas, a gente se dá conta do impacto. Eu quero parabenizar os estudos e a quantidade de informação que a gente tem que comprova a centralidade dos recursos humanos e a importância de cuidar
and the importance of taking care of these resources. I'd like to mention that these results that are being presented, but the political invisibility that happens, in the sense, the elements about how the precarious work, this is the worst moment, but also allows us to look at the impacts that were already happening. In this sense, I'd like to highlight the key topics that within this work category. In the health category, we need a space that has to be thought about as not only something that is there, but as investment. It's an area in Brazil that's growing and will grow more. This is an idea that we have to look at the Brazilian development in terms of resources. This is a very important milestone that provides protection actions for us. That's the first issue, which are to have working conditions for the healthcare workers, which is marked by the year of these workers and all the conditions that should be central. And we have to look at this. It's an adjustment factor and milestone. The second thing that you mentioned, Anna, are the changes, and I'm not going to dive into all the issues, but the modification regarding the family dynamics e também how it should be taken into our daily lives. I think there are many different elements that we should think about, but it's a collaboration element and the relationship between It and the family context is essential really to the entire aspect. I'd like to think now about this protection factors category. Which are the ones that public policy has to incorporate and the management of human resources, as well as the way that it was mentioned by Haroldo, just the issue of the payroll, the type of contract that these workers have, it's very precarious. These are daily factors that make the healthcare workers be more exposed. This is something that they have to consider because they have to keep their work so that they can keep these minimal situations. This is a very complex fight, but it has to be taken forward so that we can actually work on improve the healthcare workers' health so that they can help the population's health and so that the constitution can be healthy as well and so that we can work on the protection of the healthcare workers. Now, Maria Elena, as the project that you were mentioned with the analysis of the entire impact for everybody who works in the healthcare system and this clinical aspect of COVID that affects mainly the men, we also have a study that's very important that you have to incorporate this data into the factors. I think that after everything that we've seen today, for sure, having these some of the elements of public health care has to be considered. And here in the panel, we were able to think about politics, really. And the third question is, what are we to do? When each state has a different condition, we have to face the issue of really being absolutely exhausted. And the schools for public health can answer directly the challenges that we have in public health in a situation in which we are all fighting, but still not prepared. For example, when you look at CONASE, being able to follow up on the production of the curriculums at the schools and how they look at these problems, incorporating technology, but also looking at the country and looking at the experiences that each area and region had. And so this is a space where technology is there all the time, but it's not a simple transmission for this. There are spaces and areas of the world in which it's just not. So you have to work and gather information so that they can have the correct information to work on the data. The idea of planning of human resources associated to the healthcare system. And I think everything is moving forward, but we have to continue working on it. I believe that I'd like to say there was a lot of things to do. There's a lot of good to be done and a lot of evidence that we have to look into. I'd like to stop with the protective positionings and congratulate everyone and celebrate that we are all here together, and the only possibility here for us to be together and to integrate the efforts that were made from the different areas and departments so that we can actually create things that are meaningful and can provide change, and we can work with the healthcare workers. I'd like to say to all of you, thank you very much, and now I pass the floor to Georgie. Thank you so much, and congratulations to all. Thank you very much, Monica, for your word, not only for what you said, but the work that you develop. It's so relevant. Jorge, please, may I say something? I have to leave this meeting. I have another appointment. I'd like to once again say that I'm sorry for that, but I'm also available for answering any question that is more of my realm. You can give them my email and I'll answer all of them later. At this moment, I will have to leave you. Bye-bye. Thank you so much, Dr. Pontes. Before we move to Q&A, I'd just like to say something to everyone. I think that all of us have a role here that is important so that we can guarantee that the work task can be supported, protected, motivated, and taken forward so that they can at all moments, especially at the unfoldings of the pandemic to society for the healthcare workers. So now I pass the floor to Q&A.
The pandemic came to show us that not even health institutions or the university or national or international institutions were really prepared for such a sanitary emergency. What is your opinion about this sentence? So first of all, Dr. Ana Cláudia, please. I'm sorry, I lost connection and I couldn't hear the question. If you could please repeat. I'm going to repeat the question. The pandemic came to show us that not even healthcare institutions, universities, and international as well as national organizations were prepared for such as a sanitary emergency. What is your opinion about this? Nobody in the world was prepared for the pandemic. However, although we are able to criticize many things and include the problems that we had here in Brazil that were different from the other countries, one thing that is clear is the role of the Brazilian unified health system and universities. We had more than 800 projects conducted by one university. So the workforce from universities produced research studies. Maria Helena herself showed research data, but there was also the production of practical knowledge. University hospitals, public school hospitals, students and professors, they all produced knowledge. And there's also the aspect related to the response to vaccine. There are many problems that we could list related to organization, and there was no centralization. However, nobody in the world was prepared for this. I wrote a chapter in a book about safe and health work during the pandemic. We had to deal with so much ambivalence in Brazil because of the specific characteristics that we have here in Brazil. So we have to face our problems, but we have to seek for efficient solutions. And we had responses, objective responses from universities, but also from our unified health system, as well as other institutions that were important in producing vaccines like Fiocruz and other institutions. Now I would like to pass the floor to Professor Maria Helena. I agree. The world wasn't ready to deal with it. And it was also an alert to us about the way in which we've been living our lives. There are the environmental issues, and of course, they influenced healthcare systems. We were not ready, but we developed strategies. We decided we were fighting to create strategies to keep on living and working in the healthcare system. This was very important. In the past, we have never had so much remote health services and appointments. So the world wasn't ready for the pandemic, as well as Brazil. And we have to evaluate it from a broader point of view. We had, and we still have, economic problems, structural problems that we have been dealing with for a long time. So what we had was an exponential increase in those problems. And when we see how much the unified health system did, we can see the things that have to be improved and the things that we were able to do. So the pandemic enabled us to learn things. Of course, I'm not saying that we liked the pandemic. We know, we saw what happened to the world and to Brazil, and we have to deal with what the pandemic brought to us. Just like when we were not ready for HIV and we developed technologies to deal with it. Nowadays, we are developing ways of dealing with COVID-19. Of course, there are challenges and it's difficult. But nowadays, each sector has details, has developed strategies, has been thinking about solutions. Of course, each country has its specificity, but Brazil did what the best it could to deal with the pandemic. Thank you, Professor Maria Helena. Any other question?
Não sei se a professora Mônica deseja comentar alguma coisa.
Professor Monica, would you like to make any comment?
Devido ao adiantado da hora, infelizmente,
well, unfortunately, we are not going to be able to answer any further questions due to a need to keep up with our agenda. I just would like to answer about being ready or not. We were not ready for a pandemic, but our systems had huge gaps. So the level of low investment in health and in lack of development of public policies, it was made clear. So we have international commitments like the sustainable development. They're important, but our hope is that what happened through the pandemic makes us understand that we have an ecological alert to pay attention to, and we have the importance of leaders in each country, and we expect that the globe has learned to deal with situations that are similar to the pandemic, the COVID pandemic, in a better way in the future. So thank you very much. Thank you very much. And this is the end of our table. Great. Now we are going to the last part of our webinar, and I would like to invite Dr. Mônica Padilha, Ana Paula Cavalcante de Oliveira, and Professor Maria Helena Palucci Marziali. Now, Professor Maria Helena Palucci Marziali, the floor is yours. I would like to thank all of you for your contributions. I'm sure that they will give us the opportunity to have a broader discussion. And I would also like to thank all of you who attended through our YouTube channel. And I think that this is just a first stage. I think that we will have to repeat Professor Monica and Ana Paula this event due to the importance. So I feel that we've reached our objectives, and we know how much we still have to discuss and how much we need to integrate it so that we can evolve. And I would like to share with you my condolences to all the healthcare professionals who lost relatives and those who fight on a daily basis to improve the health conditions of the Brazilian population. So I would like to thank the managers who enable a development of training issues and better qualification of healthcare professionals. And I hope that we are able to offer better and better work conditions for healthcare professionals. I expect to evolve, make much more progress. We have already made progress, but we need to keep on evolving. And it was a huge satisfaction being part of this event. Thank you very much. I'm sorry, my mic was off. Now, Professor Ana Paula Cavalcante de Oliveira, the floor is yours. Good afternoon, everyone. I would like to be very brief. I'd like to thank all of the lecturers for your words, and it was very interesting to see that your approach is not only focused on physical health issues, but also mental. And you also addressed the possibility of developing faster responses to emergency situations. And I would also like to congratulate the moderators for promoting a beautiful discussion. And I would also like to thank the participants who were with us in the webinar. And I wish you all a very good day. Thank you. Now, in order to wrap up our webinar, I would like to invite Dr. Monica Padilha. Thank you very much. I feel so moved for having accomplished to hold such an important event. The contribution of each one of you who were here lecturing were incredible. The coordination was excellent. It gave us opportunities to share a lot, and thank for those who are in the audience listening to us, because this discussion that we had today was and is very important. Thank you so much. So I would like to thank all of you who were with us today, and we wish you a very good afternoon. See you soon. Thank you. It was excellent. Thank you very much. It was very, very beautiful. Ana, it was excellent. It was a huge pleasure to be here, and I learned a lot. And I know that we still have so many challenges, but it was very good to take part in the event. I would also like to thank our interpreters and the rest of the team. Well, ladies and gentlemen, I'm sure that we are going to have another event. Now we could have an event about the policies. Now that we've presented the data, we have to deal with
Continuamos com o projeto, porque ele não terminou, e com outras discussões.
Perfeito. Muito obrigada, amigas. Una boa tarde,
buenas tardes y buen almuerzo para todas, para los que están en Brasil. Adiós.
Tchau, gente. Tchau.
Rodrigo, você está me ouvindo?
Ouvido.
Rodrigo, como eu saio com segurança? Não encontrei o telefoninho.
Tem um botãozinho na barra de ferramentas embaixo, onde você abre o microfone e fecha, né, sua câmera. Tem um botãozinho sair, vermelho, encerrar, alguma coisa assim?
Não, ele só ficou aqui com o botãozinho do microfone e da imagem, do vídeo. Não tem botãozinho.
Não está escrito leave, Ida?
Ah, tá aqui no final.
Não tem tradução para português o aplicativo.
Não, ele está aqui no final, tá certo. Tá bom, então. Tchau, tchau,
gente.
Gente.
Encerrar, que o meu está em português, Fred.
Tchau. Gente, muito obrigada, viu, por me ajudarem a me familiarizar com a ferramenta. E achei bem legalzinho, bem legalzinho. Vamos que vamos. Obrigada, gente. Um abraço.
Tchau, tchau.
Abraço, tchau. Gente, vou encerrar a sala, beleza?
Beleza.
Will, tranquilo, né? Acho que o Williams está tranquilo para eu encerrar aqui, né? Só ele ficou na sala e nós. Ó, gostei, viu? Muito simples aqui o negócio. Me deu um pouquinho de trabalho no começo, porque os intérpretes, eles ficavam caindo toda hora, entendeu? Na hora que eu ia ativar, eles caíam, aí o botãozinho de iniciar a tradução apagava, mas tirando isso, acho que é muito mais fácil do que quando você tem intérprete presencialmente.
Entendi, que bom.
Beleza, Fred, valeu, tchau, tchau.
Valeu, tchau, tchau.